Okay, I had a conversation with the internist again. This is a conversation with a really smart internal medicine doctor. And here's some of the things he had to say. He said, I have all these sick patients and I try to help them, to tell them about the low-fat vegan diet, but they don't understand. They're so stupid and lazy. I really don't have that much time to talk to them. I try to tell them about the McDougall diet, the Esselstyn's diet. You know, even though they don't get it, I still feel better. At least I gave them a chance. They're very skeptical of dietary advice. They got so much faith in pills. And I mean, yeah, pills are a joke for chronic disease. Internist. Yeah, I know. I mean, I don't even care that much about reading about the pills, but that's all the literature. And I'm trying to figure out a way to motivate them more to get them to try the vegan diet. You know, I had this one lady, for example, you know, she had some health problems. And, you know, I couldn't get her to eat the vegan diet because she's so afraid that the carbs would make her fat. You know, I had to let her know it's not the carbohydrates that make you fat. It's the fat in the diet that makes you fat. And the other things, the processing, the MSG, MFG and stuff, get you to eat more, the oils and all that. The low-fat vegan diet is the only hope they really have. The older they get, the more fragile they get. And, you know, sooner or later they continue down that path, they're going to start having irreversible events like MI, you know, CVA, AFib, you know, myocardial infarction, atrial fibrillation, cerebrovascular accident, and whatnot. Internist. Yeah, Kepner was reversing heart disease, hypertensive eye disease, type 2 diabetes, obesity, hypertension, coronary artery disease. You know, Pritikin was reversing diabetes and hypertension. McDougall the same, and also all the autoimmune diseases, for example. Ornish and Esselstyn, they showed it's easy to reverse coronary artery disease. And now there's case reports of CHF reversal with the vegan diet. I mean, there's case reports even of patients that haven't been cured from metastatic cancer, like Ruth Heidrich and others. I mean, this fucking diet is the most important thing in all of medicine. Everybody should be studying it. Everybody should be talking about it. I think in the future, I'm just going to say this diet in many patients can cure hypertension, diabetes, and coronary artery disease. Nothing else can do that. It's worth a try. I think cure is the key word. Cure is the word I probably should use more often because maybe that'll sort of like, you know, get these patients just to pay attention and give it a try. You know, they don't need to do it for life, but they should give it a try at least for a couple months. And I think, you know, then they'll maybe see the benefits and they might be willing to continue it. I think that word cure might resonate with them better. You can try, you know. The word prevent might prevent a disease. That's too abstract for a patient to understand, you know. And McDougall's got tons of pages of testimonials, patients cured from all kinds of these diseases with the low-fat vegan diet. Internist, yeah, and McDougall figured out the two most important things. He figured out you need to eat 100% vegan, starch-based. Okay, that's important. You got to eat the starch. And number two, he figured out that fat is the biggest problem. McDougall said that fat is the biggest toxin in the Western diet. You know, all the fats are bad, every single one of them. You know, the sat fat, obvious, raises cholesterol, inhibits electron transport in mitochondria, causes diabetes, but you're still screwed. The omega-6s cause diabetes. Omega-3s also increase insulin resistance and increase risk of diabetes. They suppress the immune system, increase the risk of prostate cancer, increase the risk of atrial fibrillation. How could something be good when it's doing all those things? You know, so what? It's also increasing your blood lipids, even though it decreases some of them. Okay, let's see. Yeah, and also, you know, Pritikin studied all the dietary lipids, and he came to the conclusion, fat is bad. All the fat is bad. You don't need it. You can get enough fat just from eating low-fat vegan diet. The tiny amount of omega-3s and omega-6 you need, it's there in low-fat diet. And the fiber itself provides fat in a sense without causing increased risk of leaky gut. Internist, yeah, fat's bad for everything. It causes obesity, hypertension, diabetes, coronary artery disease, increased risk of cancer. Yeah, it's sort of like now that McDougall's dead, all this fat's being promoted because they know McDougall's not around to criticize it. And I said, well, I speak up about it. He goes, yeah, but, you know, McDougall was better known, so more people were aware of it. And I'm like, yeah, that's the way it is. I think there's almost like an effort to sweep away the McDougall legacy of the low-fat vegan diet and sort of replace it with this moderate to high-fat vegan version of the diet. And internists, yeah, that's BS. And also the low-fat vegan diet, you know, it's been shown to prevent leaky gut, postprandial endotoxemia with the related blood clotting, amyloid-type blood clotting, microglial activation in the brain. You know, because if you got leaky gut, you tend to have leaky blood-brain barrier, so you get neuroinflammation, activation of microglia. They sense it as, you know, a bacterial infection of the brain with their pattern recognition receptors, and then they release toxic chemicals, you know, like excessive amounts. We're not going to get into all the details of that, but the bottom line is they sort of sterilize their periphery, causing collateral damage to the neurons. Internist, yeah. I also wonder if uric acid is causing blood clots. I think it's a risk factor for DVT and MI. I'm like, yeah, it is. Uric acid is the bridging molecule. It sticks red blood cells together. It also inhibits endothelial nitric oxide and the internist. Yeah, well, then that's also going to cause platelet activation, make the platelets more thrombotic because nitric oxide, is antiplatelet. It goes into the lumen of the blood vessel as a gas, and it inhibits the platelets. It also, travels as a gas inward to the muscular wall of the artery and vasodilates it. Yeah. So, and then and I, like I said, uric acid is prothrombotic. There's papers showing that. Internist. Well, maybe I should put my patient on allopurinol. What those guys did was great, but you've gone farther than them, Pete. Your Spartan Vegan diet, it not only prevents heart disease, it can prevent brain disease. It's really the ultimate version of the vegan diet, the healthiest version. It's sort of like, there's a lot of different types of Porsche cars. It's like the GT3 version of Porsche, the best of the Porsche cars, Internist continues, I got so many patients all messed up with anxiety and they're on psychiatric drugs. They're a big mess, okay, and it's not good for their cognitive function. They should all be eating the Spartan Vegan diet. McDougall and those guys didn't know anything about the brain. You showed how to prevent all this brain excitotoxicity, overstimulation stuff. You had the advantage, though, of being able to read all the articles online. That makes it a lot easier. You also explained all the biochemistry and molecular biology. People should not be eating this neurotoxic crap like MSG. You showed why they also need to eat organic because of all the neurotoxic crap in non-organic food like the GP and the atrazine. And also, you pointed out that caffeine's a brain toxin. Same thing with a lot of these mitochondrial inhibitors, the ones that get across the blood-brain barrier. That's what the brain needs is to make energy. How can the brain function when it's got mitochondrial inhibitors on board, simultaneous neurostimulants, and then all these things that are dropping oxygen, glucose, blood sludge problems with these psych drugs? You figured out all this crap, and the answer is right fucking there, and no one cares and no one knows.